Professor Hilary Graham, CBE, who's a Professor of Health Sciences at University of York. And then afterwards, I'll be asking for reflections from Professor Sir Stephen Holgate, CBE, who is a champion for the UK Clean Air Programme. I'll give you a quick list of some of their accomplishments. It won't be by any means a complete list, and they can add to anything that's relevant to what they say. But Hilary is part of a Lancet countdown on health and climate change funded by Wellcome Trust. And Hilary is also Associate Director of the ESRC Centre for Climate and Social Transformation. She undertakes research on public perceptions of health and climate change as part of her role on the NIHR Public Health Policy Research Unit. And Sir Stephen Holgate is founder of the Committee on the Medical Effects of Air Pollution, chair of the Expert Panel on Air Quality Standards and Hazardous Substances Advisory Committee, was a member of the Royal Commission of Environmental Pollution and a special advisor to the Royal College of Physicians on air quality. So that's just a few of the things that both the people you're about to see do. I think I will pass on to Hilary right now and welcome her and leave it to you, Hilary.
Thanks very much indeed for that introduction. So what I thought it would be helpful to do is really to share some thoughts. This is very much kind of thinking in progress. And what I want to do is, in terms of structure of my presentation, is to say a few background points. It'll be very familiar to some of you and maybe less familiar to others. So after the background points, I want to introduce some questions, which I thought might be relevant to the Healthy Places, Healthy Planet theme. And then along with those questions, I'm going to present some data and then finally reach some tentative conclusions. If I can get this to move, which I'm struggling to do. Right, here we are. Great. So some background points. I think we all share an understanding of public health mission, which is about ensuring conditions in which people can be healthy. And climate change, driven by greenhouse gas emissions, is rapidly undermining those conditions. It's a major concern going forward for public health. We have rising emissions despite the COVID drop. And global temperatures are set to breach 1.5 degrees Celsius above pre-industrial levels, which was the threshold that Paris set as the one where we would expect to see, and we already are seeing, dangerous interference with the climate system. And 2 degrees, which was the threshold set in 1992 by the United Nations Framework on Climate Change, within the lifetime of people living today. And some people challenge those estimates and say, well, this is going to happen quicker. Looking in the UK context, the UK Climate Risk Assessment has just been published by the Climate Change Committee just a couple of months ago, and it concluded very high risks from high temperatures and to people and places from river and surface flooding. The National Risk Register, which hasn't been updated very recently, but in 2020, this is from the government, air pollution was identified as the largest environmental risk to public health, and greenhouse gas emissions are the major sources of poor air quality. And just by the way, air pollution is also the largest environmental global risk to health. Importantly, the UK set a legally binding target to reduce greenhouse emissions to net zero by 2050, which is a mere few decades away. But even if we achieve that, and we are joined by global efforts on decarbonisation, global temperatures will go on increasing. There is temperature increases locked into the system now, along with the health hazards that they bring. So just another couple of points about background. I'm sure many in the audience will be familiar with modelling, which points to the major what are called win-wins of mitigation, particularly with respect to health behaviours. So what's promoted is active travel, which is of course emissions free, and I say that as a cyclist. We don't produce any greenhouse gas emissions at all, and boost physical activity, and healthy plant-based diets. Both are lower carbon and because they've got more fruit and veg and less dairy and meat, health promoting. Now, this is really to get to the guts of what I want to discuss. Framing climate change in terms of its impact on health, referred to as a health framing of climate change, is being promoted as a way of engaging the public, mobilizing public support for climate action. And the Lancet Countdown, on which I am a member, Climate Countdown on Health and Climate, that's its basic premise, that health is a vector, a way of engaging politically and publicly issues around climate change. The WHO also expounds this position. And it's seen as particularly important, this health framing, in high-income countries, which are currently relatively protected from climate change. So the questions I want to ask is, does a health framing have salience for the UK public? We're being invited to consider that it does, but does it? And specifically, do people connect health and climate change? And if they do, in what ways? So I want to sort of set the scene a bit. Now, these look very complicated data, but they're actually, I think, relatively simple in their message. It's work prepared by Simon Munzet, who's works at University in Berlin. And what he's looked at is the wiki in English, which is obviously beyond UK users. It's worldwide English wiki users. And basically he's asking the question, do people connect health and climate change? And what he's done is looked at what are called clicks, where you click on an article and then you click onto another article through that visit. And I've put the sort of explanatory information down the side. The popularity of the articles is expressed by the size of those little balls. Users click between articles on health or on climate change. You can see the pattern of visits is very much within those domains. Much fewer click between them. Very few, less than 0.5% of clicks from climate change articles go to health, and vice versa. And the connections that were made in 2020 were associated with COVID and high-profile events. And Simon has done the analysis for 21, and the big driver of the clicks was actually tracking what the COVID status of Britain was, because it was hosting the climate change conference last year. So questions about the connectivity that people make between health and climate change. I now want to draw on a project that I'm involved with for the Public Health PRU, and the project's on public perceptions of the health risks of climate change. And the project team is down the bottom. And we've done two parts. We have two parts of the project. The largest part is quantitative surveys, and it includes, among other things, perceptions and priorities for action. Plus, we have undertaken qualitative interviews, which includes, among other things, perceptions. So I'm going to start with some data from the quantitative surveys. So we asked them, which of these statements, the respondents, which of these statements best describes your view about the impacts of climate change on people's health in the UK? And as you can see, very few thought it would never have an impact. Around a third said it will have an impact, but it's not having an impact yet. But well over 60% said it's already having an impact on people's health in the UK. So one might conclude that the idea that climate change and health are linked is widely, not universally, supported. But the qualitative findings present a rather different picture. We asked people, as an opening question, the thoughts of the impacts of climate change on people's health. And there are a selection of representative quotes. I never thought of it in terms of the consequences for human life because other life took precedence. I don't really associate climate change with actual people's health. I don't think a lot of people would relate health per se to climate change and global warming, unless you're living in a specific place where your health may be threatened. I feel like when I think about climate change, I think about the destruction of the natural environment, this natural world. I think about my garden, and I think about the animals in it. So we pushed a little bit. When you think about climate change, what do you think of? Global warming, is kind of talked about as being something over there, not something local. I'm talking very generally, obviously. I think the issues that people can't see it in a way. We're here for short periods of time, yet climate change historically has happened over long periods of time. We can't point a finger to it. We can't. And certainly in England, because I think in England, we have a long way to go before climate change. So a slightly different perspective on health and climate change than in the quantitative material. And we're still working through this. And the point I really want to make as a sort of centerpiece of what I want to say is the importance of experience, direct and indirect experience, in making links between climate change and health. I mean, a friend of mine, her house was flooded. And whenever it started to rain, always in the back of her mind was that worry. Some of the elderly people, every time it rained, they'd be ringing me up and saying, what's the river level saying? And we were out there in the community knocking on doors, making sure people are all right. So it can leave a big scar mentally. I'd say definitely air pollution has health impacts. Something on the news where something like, I think it was on the little girl's death certificate, she died of an asthma attack, and a number of the participants talked about that death. Harrowing. So we can turn that back now with those insights and look at the quantitative data. And they too underline the importance of experience. So we asked a question about health climate related exposures without using the term actually climate related. Are you aware of any of the following in your local area in the past 12 months? And we asked, have you personally experienced these exposures? Has a family member or close friend experienced? So we've got three sets of data. And the list we offered was one that included air pollution, flooding, severe heat waves, severe storms, drought, among others. When we looked at climate change concern as an outcome, exposures to floods and air pollution increase the odds of being fairly concerned, as you can see, local and personally, and very concerned about climate change, both local and personal. And it's similar pattern with the perceived impacts on health. Air pollution exposure or reported air pollution exposure and floods increase the odds of perceiving climate change as bad for health. We also asked about the priorities for local action, which I thought would be interesting for this particular theme. We asked, what are your top priorities for local government to address to tackle health impacts of climate change? And the two selected, not surprisingly from the earlier comments, were air pollution and floods. The salience of head weights for health, as other studies have shown, is pretty low. And again, the importance of people's experiences. Reporting air pollution in your local area doubled the odds of it being a top priority after controlling for personal exposure, and more or less the same finding for flooding. So just to sort of think about some of the tentative conclusions. The first is the importance of the experience of environmental change. So a lot of our respondents in the qualitative study talked about climate change through environmental change. So they talked about their experiences of environmental changes in the natural world and green spaces in their gardens. So they were talking really about experiences in the places that they lived. The other theme that came up was the importance of experience in relation to climate-related exposures. So climate change impacts on people's health was understood through its exposures, particularly floods and air pollution. Again, the importance of looking at health and climate change in the places that people live. So as a sort of final comment, do people in the UK connect climate change and health? And I would suggest that experience is the medium through which people understand climate change. And science, which is the major set of information that is being distributed through the media, speaks a different language. And I've given you two quotes which were pretty much widely reported. I won't read the whole thing, but you can see the kind of density and the detached discourse that underpins both those quotes. I think it really raises the question of if we should be reframing climate change around people's everyday experiences rather than their health, but the importance of framing it in terms of people's everyday experiences. And I've put a quote here from an article which I really like. To support public engagement, in climate change, health professionals and policymakers should emphasize climate change as present, local, and personal. And that's my little funding statement. Thank you very much.